So Ovation is really designed to be able to solve for four things. First is around creating access to a trusted health system by being able to deliver that through virtual care, high quality virtual care. The second is around care continuity. Oftentimes virtual care is really delivered in a way that's thought to be maybe episodic or one and done. And really for you to be able to provide and experience a high quality virtual care visit, it needs to be about care continuity, building a relationship over time that starts virtual first. The third thing is really around integration. So we're built on Epic, which really makes it for a deep integration between Ovation and its customers. The fourth thing would be around quality. So for you to be able to really build the trust of a hospital or health system, we need to be able to provide high quality care. And if a provider there, that health system is referring to Ovation into a virtual experience, they need to know that our team is able to see a continuous care record, that they're able to follow up on maybe a visit that they started. So it's really being able to provide a high quality, aligned to the standards that a health system would expect, but we just happen to do it virtually. Virtual first care really honors a patient's preference and how they want to be able to receive their care. So when we talk about virtual care, that's really the modality. A virtual first means my first preference is that I want to experience that care in a virtual method. I want to be able to have a virtual primary care provider. And when I need to be seen in person, I have a trusted relationship with a provider who then's going to tell me, Jared, I need you to be able to go in and get these labs drawn, or I think it's best that we get you set up with an in-person visit for it's a referral into a specialty. And you're really leveraging maybe investments that health systems or investments in services that already exist in the community. For us, virtual first, I define it as being virtual first, local always. For you to be able to provide really high quality care, you need to know what resources are in the community. You need to know if a patient has a social determinant of health that's keeping them from being able to maintain their health. And so that's how we define virtual first care. Oftentimes we hear virtual care teams, or maybe it's somebody who's leading digital experience, and they talk about we need to have a digital front door. And at Ovatient, we talk about really having a digital health home, one place that patients can be able to come, get the care that they need from a trusted care team, the content that might be necessary in terms of being able to help them understand their condition. But we're really starting now to think more about, as we think that analogy, that really it's almost the digital front porch. And that's when we're looking at AI and being able to engage patients with, or patients are using it to engage with questions that they might have about their condition, almost using it as like a triage, maybe a playbook for that conversation that they want to have with the provider. I've used it even in a way to be able to help my parents be able to prepare for a visit with a surgeon, and not knowing what did this image look like. So that's kind of, I think you're going to see this, and I heard a lot about this at Vive, talking about the role of AI. It really, I think I like to call it the digital front porch. So recently I was at the inaugural Stanford Consumer Health Conference. I loved being able to kind of hear the progress that a number of these companies, say like WHOOP or Oura, and what they're able to develop. Oftentimes though, it's cash pay, or people are still not covered by insurance. And that's one thing every single panel talked about, how they need to be able to democratize care. And that's one of the things we talk about Ovation, is that we're democratizing virtual care and direct-to-consumer care, is because for patients that come to Ovation, they're able to either pay cash, or they're able to use their insurance. And so I think that's what's really important, that too often these models, and too often it's really been like not able to appeal to those who do have insurance, or maybe even have their insurance. And we're seeing this so much now. People who are insured, they're underinsured. They're not able to afford the care that they need, that they want. And so they're still able though to pay for that from a cash-based perspective. So one of the things that I saw though at Stanford was, so what happens then when I have this great direct-to-consumer experience? How do I take that data and I then confer it or share that with my care team? Yes, you can put it into an LLM or ChatGPT, Claude, to help decipher that, but there still then is care that needs to come from it. And so I think what I really took away from that experience was, we need to create an interface, and that's where virtual first care really begins. I think has a great opportunity, is to help those patients who have that data, have that experience, maybe it's from a wearable, and then be able to relate that into their, with their visit with a provider.